Chief Medical Officer for CMS in the Chicago Regional Office. I was in that position for about 3 years prior to going to the Illinois Hospital Association, where I was a physician executive there leading quality and safety and working with hospitals and health systems in the state, and then was recruited over to my current role at Healthcare Service Corporation. So it's been a very interesting path. I've learned a lot along the way and excited about what the future holds.
Thank you, Dr. Robinson.
Man, that was polished, man. Yeah, we're just doing a career. Good evening, Stephen Martin. Let's see. My journey is, where I'm at currently, President and CEO of the Accreditation Association. And underneath that is, underneath the parent is several subsidiaries. One is the Accreditation Association for Ambulatory Healthcare, where we accredit over 6,000 surgery centers, medical and dental practices, health plans, and other primary care community health centers. So I've just made 101 days today. So still getting up to speed. Prior to that, it's been a blessing. The journey that I came from, typically, if you get on the path of being an epidemiologist, your utopia is getting to NIH, and that's it. You go to the ivory tower and you stop and you do some great work. But my path, I literally just got, best way to describe in a short way, got plucked out of that path and was asked to join the Cook County Department of Public Health and did some good work there around building out their lead prevention program. And then, was then asked to serve as Health Commissioner and CEO for the County of Cook. And at that time, the president, I think as I look back, wanted to do something bold, something different, and put the fourth leader of a 67-year-old organization with a little color, a little difference, a little different kind of skill sets than was previously there. From there, I went on over to the American Hospital Association, where I served as Chief Program Officer. I felt that we did some really great work in public health in my tenure at Cook County. But public health is a kumbaya story. We're trying to save the world before bedtime. And unfortunately, all of you who are on the healthcare delivery side weren't hearing us until ACA got passed. Mm-hmm. So prior to that, I didn't know what was going to happen, and said, you know what, let me go to the dark side and be a double agent. And so I felt that was going to have my skill sets were going to help in helping my colleagues on the healthcare delivery side inside the American Hospital Association to really help them think through this trajectory we were on in terms of population health. Phenomenal experience. I worked with Derek at the same. He was at IHA and I was at AHA at the same time. And then from there, joined the Accreditation Association. And can't tell you much, but you don't go to school for accreditation. And it's one of those careers that you just end up in. But I've been doing accreditation in various other formats, and it's a space I have always enjoyed. And now to actually do it around healthcare, I feel is one area that will definitely have a significant impact in today's healthcare transformation, because it's all about value and quality. And we're that third piece that actually checks to make sure you're doing value and quality. Thank you.
Well, good evening, everyone. Can you hear me?
Yes.
Okay. I can't hear. I can't hear it, and so it sounds like there's no mic here. But my name is Kenya McRae. I am VP of Research and Development here at AOA. My career path, totally different from, I never thought healthcare would be where I would go in. I am, by training, I am an attorney. Since I was 9, I said I was going to be an attorney, and that's exactly what I set out to do. Went to DC, practiced. I'm licensed in Maryland, DC, and Virginia. And somewhere in the courthouse, arguing with someone over some silly things, I said there has to be more to life than this. And so with that, I happened to call someone at NIH, the Ivory Tower. I had no idea what NIH was. I had no idea what public health was. He said, come over, and I said, what is that? He said, just come on over, see what we have to offer. And I joined, and as I say, I got hit with the public health bug. I did research, I was a program officer, so I helped run some research programs. And then I decided I want to sit at the big person's table. So I decided to get my MPH, and I went and got it in epidemiology from George Washington University. And then I said, that's not good enough. I wasn't, what do they say, a glutton for pain. Decided to pursue my PhD, and I knew I wanted to come back to Chicago. And so I applied to UIC, and that's all I cared about. I was coming back to Chicago. And so I went to UIC, did public health and community health sciences, focused mainly in children and adolescents. And then I ended up at ACS after I finished American Cancer Society. Cancer was not an area I thought I would ever touch. I lost my grandmother to cancer. And so it was just one of those areas you said, no, you don't want to touch on that. But went there, met Adrienne, saw the many great things she was doing and the community program she was running. And ACS went through some restructuring, and I left and went over to another totally different area dealing with orthopedic surgeons. And then I found my way back with Adrienne here at AOA. I had no idea what osteopathic medicine was. I had never heard of a DO. I did not know there was a difference between MD and DO. They started saying allopathic, and I said, what is this?
Translates to public health.
You know? And so I have been here a year now and love it. I'm learning constantly, but that is what excites me, to constantly have a new challenge, to constantly learn. And you can probably tell from my many degrees, I am a continuous learner and professional learner, I guess, a professional student. I will take that, and I don't see, some people feel that's derogatory, but I don't. That's what life is about. You're constantly learning and constantly growing. And so I am now here, and now I'm also tonight your tech. So excuse any screeching or anything of that. I'm still learning.
I started my career at 15 years old. I was the director of a summer youth employment program in Kansas City, Missouri. And part of what we did is we made sandwiches for school children. And we hired individuals who didn't have very many opportunities, and we put them on the line to make the sandwiches. And I remembered at that time, because that's what started what I'm passionate about, that I was trying to figure out how can I motivate these individuals in order to make these sandwiches all day long, and to really do it in a way so that child that's going to get that sandwich would have the best possible sandwich there is. And that started my lifelong passion for how do you bring out the best in people, and what does it take, and what kind of a supervisor or manager or leader can really bring out the best in people. And I did that every summer, and then I went off to college, got a degree in biology, came back, worked for a couple more years in the youth employment program, went off to graduate school, got a degree in master's in hospital administration, became a hospital administrator. My first job was a director of patient affairs, and that was inpatient and outpatient registration back in those days. And then I got promoted, and I was in charge of all support services, and that was all your housekeeping and your facilities. And then I got promoted, and I was then in charge of ancillary and support services. And so now I added all the clinical areas, laboratory, radiology, nuclear medicine, etc. And then I became a vice president, and I had all of then the support services and ancillary services. And so that was when I was telling you I was on this career path, and so there was like this next place that I was supposed to go, and I jumped off, and I had this opportunity to become an internal consultant and educator around managing change. And I said I wanted to do it because what I came to understand about change is that in order to bring about change in an organization, it takes leadership. And it doesn't take management, it takes leadership. It takes leadership to cause people to want to go to a different place, to want to be better. And I said that's what I believe that I had, that I was given, a gift that I was given. And so I got off that career path. I studied for a year. I apprenticed with a global organization that was globally doing work around change, changing countries, changing organizations, and came back into my organization, Lutheran General Hospital out in Park Ridge, Illinois, and I became their internal guru along with the physician around leading change. We educated all of the leadership in the organization, all the managers, supervisors on change. We were the consultants for any change initiative that Lutheran was bringing about. And that was in the early days when they were getting together with Evangelical, and that eventually became what you know as Advocate Health System today. And then after doing that at Lutheran General, I found that everybody now wanted to hire me because I had this change expertise. So I got hired as the Chief Operating Officer at St. Joseph Hospital, that I guess they're part of the prison system now maybe. And then I got hired as the director of the Foster McGaw Hospital as part of the Loyola University Medical Center out in Maywood. And then I decided that I just wanted to dedicate the rest of my career to just doing this kind of work. And I started my own consulting practice, and I've had a consulting practice since 1996, and that leads me to where I am today.